My name is Thomas Schockert. I'm a doctor for general medicine, acupuncture, natural medicine, sport medicine and emergency medicine. I have a practice in Nideggen and I've been here for 13 years. And I got to know scalp acupuncture in 1995. And after visiting the first seminar on the subject, I knew it was really my thing. Scalp acupuncture attracted me because it's necessary to diagnose the patient before the needles are placed. There are diagnosis points on the arms, on the stomach and in the throat, and these sensitive pressure points show me which points I need to address with the needles.
Die die richtigen für diesen Menschen in diesem Setting sind.
The most important area for treatment for YNSA is stroke treatment. YNSA, paralysis and speech impairment after a stroke can be helped. Together with the University in Bonn, Professor Schumper, we've examined this phenomenon, and 59% of the people we examined in this study had experienced improvements.
Besser bewegen.
As Mr. Gerenstein visited me for the first time 5 years ago, he had a hemiparesis or partial paralysis on the right side of the body. He had a lot of difficulty in walking and he couldn't move his right arm and particularly his right hand. We treated the antispastic point many times, and during the course of the treatment, the movement in the right side of his body improved markedly. He can now walk in a perfectly normal way and open and close his hand in a perfectly normal way.
Und willentlich öffnen und schließen.
You need to imagine how down I was at the beginning of this treatment. If you can see what's happened during the course of this treatment, then you can imagine that the massive improvements have been made, and Dr. Schockert has really helped me with this course of treatment. And as I just mentioned, the whole time during the treatment, I noticed that after the treatments, I got better and better, and the movements got easier and easier. And my therapists in my ergotherapy and other physical therapies, they noticed this as well. YNSA is a real improvement for physiotherapy and ergotherapy. In my practice, I've noticed, for example, that patients after a stroke can be treated with YNSA, and immediately after setting the needles, then the physiotherapy and the ergotherapists have noticed a distinct improvement. Melanie was very skeptical before the treatment. She couldn't imagine that acupuncture would help her. She had difficulty in opening her mouth, and the mouth would only open one finger breadth. Her mouth opening was so reduced that she had difficulty eating. After the first YNSA treatment, she could open her mouth so far that she could get 2 fingers between her teeth. I have problems with my jaw, that it won't open as far as I would like, and I have difficulties eating. And I always have some tension in my jaw. After the last treatment, particularly after one needle, this tension was reduced, and this continued after the treatment as well. For me, that I'm really surprised how much of an improvement I've made, and I hope that it's going to be the first time that I can really start to eat properly after this treatment.
Gibt es in deinem subjektiven Empfinden
Subjectively,
einen
do you
Unterschied
feel a difference between right and
oder
left?
links?
Ja, rechts ist.
Right is more sensitive, no? More tension.
Dann komme ich mal
I
hier auf die
come
Seite.
over to this side
Ich untersuche
and
zunächst
examine the
Nierenpunkt.
kidney point.
Niere. Ist
That's
empfindlich.
sensitive, no?
Der japanische Arzt und Wissenschaftler Toshikatsu Yamamoto
The Japanese
hat
doctor and
Y
scientist Dr. Yamamoto
erfunden.
discovered YNSA and has continually developed it further until
Yamamoto
today.
hat im Jahre 1973
In 1973, Dr. Yamamoto discovered the original 5 points for YNSA acupuncture, which he presented to the general public.
Man kann die
YNSA can also be particularly useful with mobility problems.
dazu ebenfalls mit Herrn Professor
Together with Professor Schumper at the University of Bonn, we examined 104 patients. These patients were examined with the help of a real-time ultrasound topometer.
untersucht. Die Patienten
Patients showed us before the treatment which movements caused them the most pain.
wehgetan hat.
Then we treated them with YNSA, and immediately after the treatment, Professor Schumper, with his real-time ultrasound topometry, measured the mobility
erneut
and
aufzeichnen.
could show the difference immediately after the treatment.
In unserer Studie konnten
In
wir
our
zeigen,
study,
dass
we could show
93,3%
that 93.3% of the affected patients, 93.3% of the patients affected by pain showed marked improvement in their pain therapy after the first treatment, and some of them were even pain-free.
Wie fühlt sich das jetzt
How
an?
does that feel now? A lot easier, less tension.
Ja, damit ist
Then the treatment is finished for today. Thank you very much.
Ich danke dir. Für die Anwendung
For the application of YNSA, there are no limitations. There are no limitations regarding age, so young people as well as senior citizens can be treated.
und die
And
YNSA.
YNSA is largely without any complications or side effects.
Es ist
It's a very safe form of treatment and very well examined
kann an jeder
and
Stelle
can be carried out in any situation. Patients don't need to come into the practice. Even the patients in an emergency situation on the street can be treated successfully.
In meiner Praxis
In my practice, I had a classic case. It was a small child, only 1 year old, who had already experienced 3 strokes.
hat in Zusammenarbeit
Together with Dr. Yamamoto, I treated this child, and the child experienced a lot of improvement.
hatten, konnte sich
Before we started the treatments, the child could only move on the ground in a very uncoordinated way.
und im Laufe der Behandlung, diese hat sich über eine
During the
Zeit
course of the
von 2
treatments,
Jahre erstreckt,
he learned to use his legs and his arms and the function and use of his hands.
zu benutzen, und die Funktion der Hand ist auch komplett wiederhergestellt worden.
That's the most satisfying experience that I've had so far.
Andreas hatte einen Verkehrsunfall.
Andreas had a traffic accident,
Sehr, sehr starke Schmerzen.
and following this, he had a lot of pain in his neck and in his head.
Hat sehr
He took a lot of strong pain medication,
hat aber
which unfortunately didn't help.
Schmerzfreiheit erzielt. Und bereits
After
nach
the
der ersten
first
Behandlung
treatment,
vor
about 10 days
10
ago,
Tagen, hat
he
er
noticed a
eine
real improvement.
Fortschritt erfahren können.
The headaches were reduced,
Kopfschmerzen waren weniger,
and particularly the mobility in his neck vertebrae had improved considerably.
viel besser als vorher.
After the first treatment, I noticed a real improvement, and then I had 4 further treatments. Then I noticed a real improvement. And now I can do everything normally again. I can work, which I couldn't do before. I couldn't read, I couldn't use the computer. I could really only lie and do nothing. I thought my skull was going to explode. I was sad that nobody had told me about this treatment in advance, that this possibility existed. Conventional therapy, I was told that I would just have to suffer for a further 3 months, probably. And after the first time and first treatment with the needles, I noticed an immediate improvement.
Die große
The
Bandbreite
range of treatments possible with YNSA ranges from acute respiratory failure to tinnitus, to eye problems, to allergies, and particularly neurological problems.
sind sehr dankbar. Wissenschaftliche Studien,
Scientific studies, particularly mainline medical studies, are published in Medline, which is the library of the American health
der
authorities,
amerikanischen Gesundheitsbehörde veröffentlicht.
and YNSA studies have been published in Medline.
Zug in die Medline gehalten.
That means
Das heißt,
that YNSA research is recognized world knowledge.
Amgard hat einen Tinnitus.
Amgard has tinnitus in her right ear.
Die Behandlungen schlagen
The treatments
relativ gut an.
help, but they don't last very long. That means the intensity of the noises in her ear
Kurze Zeit.
is only reduced for a short time.
Ist es hier empfindlich?
Da. Also ich habe eigentlich
I started the treatments immediately after experiencing the first noises in my ear,
jetzt
and that was, let me think, 2008.
8.
Ist es hier
Is it
empfindlich?
sensitive here? And sensitive here too?
Hier
This
ist
is the curve showing the tinnitus line.
Besonders eindrucksvoll.
I was particularly impressed to Amgard's reaction
als Amgard
after we treated her bad toothache.
hatte. Nach der Applikation
After applying only 3 needles, brain base point 1, yin base point A, and the mouth point, the pain had disappeared completely and she could eat perfectly normally.
die
YNSA is particularly suitable for treating toothache,
Und ich sehe da auch
and I see in the future
das Feld zur
a lot of possibilities for cooperating with my colleagues in dentistry, and I think YNSA in dentistry is the next topic that we need to plan.
Die YNSA
YNSA is very fast and very easy to learn, and working with YNSA is very enjoyable.
Ich würde mir
I would
deswegen
like to hope that my colleagues in the medical profession, that lots of them would learn YNSA.
Es gibt viele
There's a
Informationen,
lot of information available on YNSA,
aber auch in
on the internet, but also in various books that have been translated into different languages.
November diesen
In
Jahres
November, a new book on YNSA will be published by the publishing house for systemic medicine in Bad Kürtzingen.
erscheinen.
This book is suitable for doctors,
Für Ärztinnen und
but also for interested lay people
die zum Beispiel
who want to treat themselves or their relatives by acupressure.
behandeln möchten.